The great Papa Bear is about to retire.
And he told me, I won the Nobel Prize in medicine because of Igal. I said, well, explain to me, how did that happen? And he said he was a senior surgical resident when Igal was a second-year resident and came into the operating room. And Igal started operating, and it was like watching a concert pianist. He said he'd never seen anything like that. And he went home to his parents that night and told them that he was quitting clinical medicine to become a researcher, because he knew that it didn't matter how many years he would spend, he would never reach a level of Igal Kam.
I remember scrubbing with you for the first time in 1985 in Pittsburgh. You taught me how to do liver transplants. You taught me how to do organ recoveries. I still remember one of the first baby liver transplants we did. You brought the organ back and it literally fit in the palm of your hand. That baby is now 30 years old and an electrical engineer.
Dr. Kam told me, Roshan, you and I are both from the old countries, and one thing I have to tell you, once the liver fails, everything fails. So the only way you can save these patients from liver failure is by giving them gift of life, liver transplantation.
There was a lot of skepticism about whether liver transplant could be successful because of the history of liver transplant at the University of Colorado, and Dr. Kam had a point to prove. I remember that very first patient that Dr. Kam transplanted. 4 days later, he presented grand rounds to speak about the new age of liver transplant, and that patient walked into the grand rounds auditorium and said hello to the whole group of physicians and surgeons that were in the room that day.
But probably your most noteworthy accomplishment, of course, was becoming the father, if you will, of the living donor liver transplant. And people don't realize how significant that was. You know, to fill a void in liver transplantation is, of course, one thing, but to go through the process of setting up a whole new program like that was really challenging, and you led the troops through that all the way.
What I've most admired about Igal is the passion that he brought to his daily work. There was never any question about his loyalty to his transplant patients, his care for their well-being, his concern about getting the right donor that was going to save their life.
I never met a patient that didn't like you, and early in my career I can't think of many patients who didn't say, "Have you run this by Dr. Kam yet?"
I don't even think you realize what you meant to me during those 21 years. Through the good times and the bad times, it was all about the team. When I talk about the interdisciplinary team and talk about Dr. Igal Kam and the amazing team skills that he had in using everybody on the team to produce really good patient outcomes.
Virtuoso surgical talent and his incredibly generous heart and focus on family, that's a really rare combination of attributes, and it's because of those attributes that he became one of the best transplant surgeons in history.
One of my most favorite quotes was, "I am not saying someone is lying, but one of you is not telling the truth." So he called it as he saw it. And I also think what was really frustrating is that he was right about 99.5% of the time.
I learned a lot from you, and I remember the first time I had a patient on the inpatient service, and it was a patient with acute hepatitis B, and you told me, put him in the ICU and I will transplant him tomorrow morning. And I said, Dr. Kam, he doesn't fulfill criteria for status 1. We can't list him like that. And you said, you come in the morning and he will be confused, and then I will transplant him. And lo and behold, the next morning the guy was completely encephalopathic. We put him in the ICU, and that evening you transplanted him. I learned
The OR team could tell this story better, but I've heard many times that he's famous for saying, quickly now, the liver is dying.
I know the team will miss you, but I think they'll be happy not to hear any more shit goddammits from you anymore coming from your office. You probably don't say it that much anymore, but that's one of my favorite things that I used to hear you say. It would always make me smile.
I learned that the Papa Bear was always right, and that we should not poke the bear, as we did say many times at selection conference when you weren't there.
You've raised me since I was a little pup in the transplant community, and I just wanted to thank you for all that you have taught me over the years. Your integrity has been something that we all look up to.
You've made my career, my training, a priority, and I appreciate that so much. Every patient that I take care of, I have taken care of. You know, your hand is there. You're largely involved because of, you know, what you've done for me, and I appreciate it. You're like a father to me in many ways.
You are obviously one of the greatest giants in the field, and you have saved so many lives and trained so many surgeons, including me, and if I can even be half the surgeon and doctor that you have been over all these years, I'd be happy. I still remember how excited I was when I learned that I would have the opportunity to train with you in fellowship. And then I remember how my heart skipped a few beats when you offered me a faculty position here.
Igal Kam, thank you very much for everything you've done for the field of transplant, for the University of Colorado, and for me. I really appreciate it. I think that I join a long line of people that can say that you made us better doctors. Best wishes.
You're a pioneer in the field, and I couldn't be happier having accepted this position, and I'm so honored that you chose me.
As you go into your retirement, Dr. Kam, thank you for the countless number of patients that you served. You've been a great partner. I've enjoyed working with you, and I wish you nothing but the best in your future travels.
So congratulations on your retirement. I know you're looking forward to it.
We owe you a lot, and I'm wishing you all good things as you head off into retirement. Thank you so very, very much.
I'm really grateful for having the opportunity to have worked with you. All the best.
Great to know you, learn from you, and appreciate your friendship for the last 30 years.
Thank you for all the opportunities that you gave me, and the great career, and the things that you taught me. And hopefully I can follow you into a happy retirement.
Well, congratulations on a wonderful career. Thank you for all that you've done for the transplant community of Colorado and really the world. But most importantly, I just want to thank you for your friendship. I wish you the absolute best in your retirement.
I toast you, Igal. I hope the next phase of your life is very happy and healthy. Salud.
You know, best of health and happiness, and you know, us old guys with bad hearts have to stick together. So hang in there, and Chindan, which is Italian for may you live 100 years.
I am so excited for you and your retirement. I wish you all the best in all your travels and new adventures. You are loved greatly and will be missed dearly.
Thank you from the transplant community at large. You're just fabulous.